Hey, this is Becky Oster-Blanton from Active Health in Portland, Maine. I'm doing a video today on back pain and the top 3 things not to do when you have back pain. So I get a lot of people that ask me about back pain, what they should do, about stiffness, about aches and pains, muscle spasms, and I'm going to cover that in this video. One thing I want to talk about is that when people have to have surgery on their back or they need shots, it's not from a car accident or a fall or fall down the stairs or something really traumatic. I mean, that does happen, and people end up in the hospital, they end up with surgery, they end up with this or that. But a large part of day-to-day pain comes from just bad positions, chronic repetitive postures, chronic movements, repetitive movements, bad body mechanics. And that doesn't get the emphasis that it deserves on how important it is to do the right things and take proper care of yourself. And I'm talking about bad pain, pain that messes with you, pain that keeps you out of work, pain that keeps you from playing with your kids, pain that costs you time and money, pain that ruins your life. So I'm not saying car accidents and falling down the stairs can't cause that kind of pain, but most people that get shots or have surgery or have chronic pain started out as something simple like, I get up in the morning or I get up after sitting at work and my back is stiff. So if your back is stiff or you do have light aches or pains, that's not normal aging. It's not because it runs in your family. It's not because, it's always been that way or it's always going to be that way. It's an indicator that something is wrong. It's an indicator that you can, something is going wrong in your back and that you should do something about it. And what happens is people have the stiffness or a light pain and they can still function and do all their activities and go to work and play with the kids. But, you have to warm up in the morning or, I have to wait a few minutes before I get out of bed. That's an indication that you have a problem that's going to turn bigger. It might take 6 months. It might take a year. But you need to deal with this problem. It might even take 10 years. But at some point in your life, you're going to have massive disability where you're stuck bent over or you're missing work or you're at the doctor looking at injections. So whatever you call it, stiffness, pain, soreness, an odd feeling, it's something you need to deal with. And, you can deal with it early. And, I do some manual work on your back and we give you some stretches and some exercises and knock it out. Or you can deal with it later where you're coming to me saying, the doctor says I need to have a fusion or I need to have injections or I'm going to be out of work for 6 months. And then I'm looking at 3 to 6 months of treating you, and I don't even know what kind of outcomes I'm going to have because your process it's so far along. It's gotten to the point where your pain is so bad that now you can't do the things you want to do. You're missing work. You're not playing sports. You're not exercising, and then you're getting other health problems. You're gaining weight. Your diabetes is out of control. You're starting to get arthritis from not moving. It cascades into a whole other litany of problems. So if you take care of it early, then we can do something about it. So it's that stiffness that can turn into disc problems, or you can't sit at work, or, so we want to just take care of that because you can spend a ton of money and a ton of time fixing it 5 or 10 years from now, or you can take a couple hours and take care of it now. So come while you still have a mobility and take care of the small, simple problem. That's kind of my soapbox. That's why I'm into physical therapy. Preventative medicine isn't a big thing. So we wait till we have a little problem and then we prevent a bigger one. So I'm going to go through the 3 things that you shouldn't do when you have back pain. The first one is lay on the couch. So when I take a history, when a new patient comes into me, I get I started and I have these spasms and I was bending over the sink and my back locked up and I couldn't move and, then I say, what would you do next? Well, I went and laid on the couch. I don't know how many people, it's amazing how much time people will spend on the couch. When you get a spasm, it's muscle, it's seizing up on you. The worst thing you can do about a muscle that's seizing up on you, deprive it of fresh, healthy blood. Deprive it of nutrition, deprive it of warmth. When you lay down, no blood goes to that area. The area gets stiff, it gets cold, it gets hungry, it gets angry. So that never helped anybody. What should you do? You should walk. Get out of your flip-flops or your high heels, or any kind of special shoes that you're wearing. Put on a comfortable pair of sneakers or stay inside and stay barefoot and walk. And just a few blocks and swing your arms and try and breathe, deep breaths in through your nose, out through your mouth. try and get some mobility, try and get back up straight again. I'm not telling you to go run a marathon or go walk 6 or 7 miles, or don't go hike in the woods and trip over branches, and you don't have to go up some big steep hill. But please, whatever you do, do not lay on the couch. When you walk, you get a rush of blood into your back, into your legs, into your muscles, and you increase circulation. Even if you have a pool, that's awesome too. Get into the pool and just walk around in the shallow end. It takes some of the weight off, it unloads, it'll feel good, and you still get that circulation, still get some exercise. That's a great option. Whatever you have available to you, keep moving. The second thing is, every time somebody hurts their back, they keep redoing what they did. Don't bend from the waist. I'm gonna bend over to see if it still hurts. Well, you shouldn't have been bending from your waist in the first place. You wanna see how to lift? Go to a daycare center or to a school of very young children, 5 and under, and throw a ball in the middle of the room, and they will all run over to it. They will squat down, grab the ball, pull it into them, and stand up. We were all born with the innate ability to have great body mechanics. And somehow as we age and get older, it falls apart and we start bending over at the waist and using our back muscles and these giant levers to lift heavy weights instead of these big, huge thigh muscles and butt muscles that were made for it. So every time you bend over, you're like herniating your discs out the back. And you might do it for a year or 10 years or 5 years or 3 months. But one of these times, you're going to do it and you're going to get stuck. And then you're going to have that pain. You're going to have a spasm. You're going to throw out a disc. We're all built the same. You're no physiological wonder. I wish we were, but you're not. And one of these times, you're going to get hurt. I do a survey when my patients come in, if they're up for it. I say, I bet you can't do 30 squats, down and back up, without getting either out of breath or, without telling me your legs are sore the next day. We should be able to do 30 body weight squats, at a decent pace, all the way down to the ground, to like pick up a shoebox or an exercise ball or a soccer ball. But most of us can't do that. The other option you have is to pick up like a golfer, like stand on one leg and pivot. That keeps your back flat. And then again, the majority of the force goes through your hips, not your back. So all these little micro traumas, every time you bend at the waist, it adds up and it adds up and it adds up. So that equals shots and missing work and losing money and losing beautiful time. The other thing that you should never do when you have back pain is don't sit for more than 30 minutes. I know, but Becky, right? We all say it. I have to sit at work. I have to drive to work. I have to do this. I have to do that. I'm not saying you're never going to sit for 30 minutes or more, but my goodness, when you're at your desk, stand up. Again, that rush of circulation through your legs, through your back, even into your brain. Studies show that people who stand up and move around are more productive, have more energy, eat better, just from standing up. And if you have a sit-to-stand desk, use it. Bring that desk up to standing. I'm not saying you have to go out and walk for an hour or two. I understand. I work too. We're stuck here. We have to do our job. We have productivity. We have things we have to get done. That's fine. But at least set a watch or your phone, and when it beeps, just stand up, stretch your back, move around, turn in circles, walk to the water cooler, go to the bathroom. Just take a break. Just get out of that posture. So whatever you have to do, you can do that and just stand up on your tippy toes, rock back on your heels, take a deep breath. This costs thousands and thousands of dollars every year, hundreds of thousands of dollars as a country for people with back pain from sustained postures and repetitive motions like bending at the waist. So, yeah, my back is sore, I hear you. And you don't think sitting has anything to do with it. But you know what? It has everything to do with it. It's what's destroying your discs and muscles more than anything, is being slumped over in that C position from sitting with your discs popping out the back. They're screaming at you to stand up and distribute your weight evenly through them and give them a rest. So if you want to save a lot of time, you want to save a lot of money, come to your local physical therapist while your back is stiff, or while it feels kind of funny, or while you have that little tinge occasionally. Those are signs that something is wrong, and that something is going to go more wrong, and your problem is going to go from being, it bothers me a little bit, but I can walk it off, to a problem that is going to keep you home from work, put you in the surgeon's office, or have somebody stick some big long needle into your back. Who wants that? So I put a link for our workshop. We have a back pain and sciatica workshop that we do. It's free. It's, we do one once a month. There's a link you can click on and sign up, get yourself in here. And like I said, come spend 4 or 6 or 8 hours with me over 4 weeks and take care of your small problem rather than seeing me 3 times a week for an hour for the next 6 to 9 months, trying to avoid the surgery that's going to end up costing you $5,000 out of pocket and 3 months of lost work and being depressed and not being able to do things with your family. You come to see me, it's 2 hours a week. You still have all the rest of your time to work and do things on the weekends. You're not debilitated. You're not laid up. You're not missing out on life. You're not getting depressed. So come take care of your problem early. Even call us, 878-5002, area code 207. I'll set up a free screen. I'll take a half an hour to talk to you about your back pain and see if it's even something that is a problem or that you even need physical therapy. Maybe you just need a gym membership or a walking program. I'm willing to do that for free just to help you out. So give us a call, 207-878-5002, or click the link down there and sign up for our free workshop and come find out what it's all about. All right, I will talk to you soon. I look forward to seeing you. And remember, don't bend at the waist, don't lay on the couch, and don't sit for more than 30 minutes, and you should be on your way to back health. Have a great day. Bye-bye.